Kemi Badenoch is with me this morning, Secretary of State for Business and Trade. I don't think I've ever interviewed you in the flesh before. Good
Morning.
to see you. Exciting. Let's start off with the election proper, should we? Apparently, a Conservative candidate for High Peak in Derbyshire, Robert Largan, on social media posts on Saturday in red, Labour colours, saying Labour for Largan. And then in the Reform colours, he said Reform for Robert. But he is a Conservative candidate. Is that an appropriate way for your candidates to advertise themselves? Would you do it?
Well, I saw what Rob, who is a fantastic, certainly has been a fantastic MP, put out. And what he's trying to show is that people who traditionally would support other parties are actually supporting him. So he is saying that he is the candidate, he's a Conservative candidate, but he's the candidate that has the broadest appeal. I don't think there's anything wrong with that.
Would you advertise in that way?
Everybody has their own way of doing things.
But
it's
would
not
you?
for me to... Everybody has their own way of doing things. I don't speculate on how people do their own individual advertising or campaigning.
OK, how are you planning to change the Equality Act?
So what we are doing is clarifying that the Equality Act, where it refers to sex, is referring specifically to biological sex and not legal sex, as is often interpreted. So this is a clarification in the law. It is not, as many people assume, a change. It is re-emphasising what should be the status quo. We have seen quite a lot of changes in terms of terminology. In the law, sex and gender were used interchangeably. Now we don't do that. So what we're doing is making sure that people understand what the law says. We've seen a lot of problems with people misinterpreting the law.
OK. So if this was such a big issue, why didn't you change it sooner?
Oh, well, there's so many things that we had to do first. The biggest reason is because of what Scotland was doing with its gender recognition bill, the SNP, I should say, the Scottish Government. That actually took up quite a lot of bandwidth. There was a legal case with for Women Scotland and a Haldane judgment that showed that there were issues here that we needed to make sure we understood before we put out a policy. And it's something that I'd actually been working on. But unfortunately, the election was called before we would have been able to lay the legislation in September. I think it is right that we still continue to do so and that people understood what our intention was and what we can do with that legislation.
I mean, I've read your piece, and there are obviously extremes, and those people need to be protected.
Extremes?
Yeah, but what about those that are somewhere...
What do you mean by extremes?
Well, you tell me what you actually meant by your article this morning.
I didn't write anything about extremes.
Let me ask you about
I'm just asking what you mean.
I'll do the questions, if you don't mind.
I didn't understand your question.
OK, well, let me ask it in this way, if I may. Transgender athletes, how will they be able to compete? Will there be, say, in the Olympics, would you find yourself in a position where transgender men had their own category, transgender women had their own category, and then women and men? How does that work?
So what we're not doing is giving instructions to different sporting bodies. We're making it very clear what the law is, that there is a difference between identifying as a different gender and what your biological sex is. We believe that sports is something where there are sex categories for a specific reason. People compete in women's sports because they're biological women, not because they identify as women. It is for sporting bodies to be able to manage that. Transgender athletes are not stopped for competing. They may, in some cases, have to compete with their biological sex. They may, in some cases, have open categories. But what we are trying to stop is the scenario where we see very obvious unfair advantages, people who have gone through male puberty, towering over fragile and, in some cases, much smaller females, and saying that that is fair competition. That is not right.
OK. What about public toilet facilities?
What about them?
Yeah, how does that work?
I don't understand the question.
OK. Let me try and explain it. So, you have male toilets and you have female toilets. What would you like transgender people to do?
So what we have continually and repeatedly said is that we are re-emphasising the status quo. We've put out building regulations which explain that there is a difference between having a unisex toilet and a mixed gender, gender-neutral toilet, where men and women have to use the same space, women walking past urinals to get to their cubicles. We have not said that transgender people can't use specific toilets. What we have said is that they must provide toilets for single sexes as well. And if you provide for all, that is genuine inclusion. The sort of inclusion that people are doing are actually exclusive to women and many of those people who want more privacy and dignity.
OK. Let me ask you about the Royal College of Nursing. They have put out a note today to say that there is a crisis in the National Health Service and people are having to be treated in corridors because there is nowhere else to treat them. Intimate examinations, sometimes people are actually dying in corridors. They say their staff are regularly forced to care for patients in that way. What do you make of that?
Well, I think that that is appalling. I do know that this is something that the government has been working on. We've put more money into the NHS than ever before. We do understand that there are difficulties in certain hospitals. This is not the case, certainly, in my constituency, for example. But this is one of the areas where we have been talking about ensuring that the NHS is delivering more for people, given how much that we have been putting into it. Of course, the scenario that the Royal College of Nursing is describing is not something that we ever want to see. We know that there will be specific issues in some areas. And I know that the Health Secretary has been out just yesterday, in fact, talking about what our plans in this space will be.
OK, tell me a bit more about your plans.
About?
The plans for the NHS and how you're going to make sure that people are not treated in corridors.
Well, one of the things that we're trying to do is actually make sure that we get staff back to work. We have a pledge about bringing down waiting lists. That is something that was coming down until the strikes. We've been talking about getting a settlement. We have started a programme for building new hospitals. So we do have a plan for the NHS. Of course, there will always be issues from time to time. There's never been a time when there haven't been issues with the NHS. But people have been saying for multiple decades about how we wanted to privatise the NHS, how we didn't care about it, and yet all we have seen is more and more investment in the NHS under the Conservatives. I've been an MP at a time when we put in £20 billion more. We fulfilled manifesto obligations in terms of funding the NHS, and I think that that is a record which we can be proud of this morning and throughout this election.
OK, just a couple of things to pick up on there, if I may. When you say before the strikes, the numbers were coming down, so it's NHS workers that have caused the increase in the numbers of people who are waiting to be treated?
I'm not getting into...
you said it, not me.
Yes, I know, but what I'm not getting into is any kind of conversation that makes it sound like I'm disparaging NHS workers. We value them, and we understand how hard they're working. As I said, I acknowledge what the Royal College of Nursing, has said. But what we will say are the facts. Of course, if there are people who are striking, that is going to have an impact on patients. I don't think any of your viewers would deny that. That is why we have been working with NHS workforce to try and deal with that. And one of the other things that we have done is the NHS long-term workforce plan. This was something that the Prime Minister brought out last year, looking at how we can solve the staffing issues that the NHS has for the long term, rather than relying on short-term fixes, getting people from other countries where they need their healthcare workers to come here.
OK, but you did say that the numbers would be coming down if it hadn't been for the strikes.
Yes, but that is true.
OK.
I'm not going to say something that is not true.
OK. You're pledging £1 billion a year to increase the number of GP appointment numbers, wanting to build 11 new GP surgeries and modernise another 150. But you did make quite a lot of pledges about new hospitals in the 2019 manifesto that haven't come to pass. So why should we believe you this time?
Well, because one thing happened that was not in the manifesto, and that was COVID. And because of COVID, we ended up spending far more on the NHS than anybody would ever have expected. And that was to protect people's health all around the country. And even when I'm knocking on doors up and down in my constituency, people understand that. People understood that spending, several £100 billion during a global pandemic where we all had to stay at home has had an impact on building programmes.
When you think about the NHS, what do you think about?
When I think about the NHS, well, I think about medical care. I think about when I was having my children in the hospital. I think about some of the very, very difficult births that I had with my first and second, a lot of trauma. I think about the surgery that I had during my pregnancy, twice, in fact. So the NHS, for me, is an essential institution for this country. I have... My parents were doctors. I have friends who work in the NHS. I have family who work in the NHS. But it is, at the end of the day, an institution that is meant to provide healthcare service to the British people. And
this election, 4th of July, 5th of July, we'll know who's going to be our next Prime Minister. What do you think the number one issue should be in any election campaign? Is it the NHS? Is it immigration?
It always depends on individual circumstances.
What is it on this occasion?
On this election, it is about who we want to be running the country. Whether we want the party that has a plan, which is the Conservatives, or Labour, which doesn't have a plan. That is what people are going to be voting for. People will have their own specific number one issues. Sometimes I speak to some people, it's immigration. For others, it's the economy. For others, it's the NHS. But at the end of the day, it is a package that we're offering, and the best package, I believe, is the one that the Conservative Party is offering.
Absolute pleasure to meet you in person. Thank you very much indeed. Thanks a lot.